Hello. So my name's Laura. I'm the physiotherapist. I work at the spondylitis program here at the Toronto Western Hospital. Because I'm a physiotherapist, I'm very cognizant of the fact that we've all been sitting for the last hour, hour and a half. So while I'm getting my presentation up, I'm just going to ask everybody to stand up at their seats, and then we'll sit back down when I've got it all set up. Now, let me see here. Okay. Is that working? Oh yeah, I need a mic, thank you. Okay, so we'll just wait for the presentation to come up. And I'm hooking myself up like Madonna. And you'll see what's coming later. Okay. All right, so everybody can sit back down. You have a little stretch. And I tend to move around a lot, so I hope everybody over there can see me. Okay, so first of all, I'd like to thank CSA, Spark, and our sponsors for inviting me to speak with you today. I'm going to be speaking to you about non-pharmacological management of ankylosing spondylitis. So you may ask, what is non-pharmacological management? So it includes various things such as self-management, complementary and alternative medicine, physiotherapy, diet, education. And it also includes exercise, for which we probably have the most evidence to support it as a form of non-pharmacological management for ankylosing spondylitis. So I'm going to be focusing the majority of my talk on exercise. And we know that exercise is a cornerstone for treatment alongside the medical management for AS, and this has been endorsed by our colleagues over in Europe. And as Dr. Haroon mentioned, also in the United States through recent ACR recommendations for both active as well as stable AS. And we know, based on the literature, that the benefits of exercise for AS are numerous. Exercise helps in pain reduction, it improves mobility and fatigue, it decreases disease activity and improves cardiovascular fitness. We know, and we'll learn more later, that it helps with depression, as well as it improves function and quality of life. But we have to keep in mind that not all exercise is equal, that different exercises target different body systems. So in 2010, the American College of Sports Medicine undertook a huge literature review of all the science looking at the benefits of exercise in the general population. And they came up with a position stand that reads, "The scientific evidence demonstrating the beneficial effects of exercise is indisputable. A program of regular exercise that includes cardiorespiratory, resistance exercise, flexibility, and neuromotor exercise beyond activities of daily living is essential for most adults." And I highlighted beyond activities of daily living there because in order to gain the physiological benefits of exercise, exercise needs to be purposeful, it needs to be done at the right frequency, intensity, and duration. Now, I'm not negating the importance of physical activity, such as our day-to-day routines that we do, walking the dog, we might have a very active job, and we'll get into the benefits of physical activity later. But if we want to gain the physiological benefits, we have to work within certain guidelines. And these are the recommendations for the different forms of exercise. So cardiorespiratory exercise needs to be done about 3 to 5 times a week for a duration of about 30 minutes or so. Muscle strengthening 2 to 3 times a week, flexibility 2 to 3 times a week. And I would argue, again, these are recommendations for the general population. I would say that for people who have ankylosing spondylitis, where stiffness is a major issue, that maybe stretching on a daily basis would be more appropriate. You also want to engage in something called neuromotor exercise. So you're probably asking, what does that mean? So basically what it means is training the muscles in a very functional, efficient, and safe manner. So I'm going to use quadriceps as an example. So if you go to the gym, you can go onto a machine and you can do leg extensions where you put a weight on the end of your foot and you do extensions, and that's a very good way of strengthening your quadriceps. But a more functional way of strengthening your quadriceps is by doing quarter squats. Okay, and I say quarter because you don't want to go too deep because then it puts too much compression through the knees. But quarter squats, just coming up and coming back down, is going to strengthen the quadriceps in a very functional way. Because when we walk, when we bend down to pick things up, when we go and sit down, that's a more functional way of training the quadriceps muscles. And that's what they mean by neuromotor exercise. So we know that exercise is really important based on the science, but our patients with ankylosing spondylitis actually engaging in regular exercise. So we looked at this question, it's now about 10 years ago, and I'll warn you that we are looking at repeating this study, so as Gerald mentioned earlier, surveys may be coming your way. No bias there. So what we wanted to find out is how much are people with AS engaging in exercise and what activities are they actually doing. So based on the results of this survey, we found that the majority of patients are engaging in either home stretching, walking, or attending their local gym, but they're not doing it to the right frequency in order to gain the physiological benefits. So we know as healthcare providers that we have a job to do to help tell patients that they need to be engaging in exercises, but also trying to encourage them in terms of ways of overcoming barriers to exercise. Because we all know that exercise is difficult. We all suffer from lack of motivation. We may be deconditioned. It requires investment and time, particularly if you have young families, you're in the prime of your job. And we also know that with exercise, there's delayed effect. So we don't actually see the benefits of exercise until about 6 to 12 weeks. So that's a lot of investment that we're putting into something, and we're not going to see the results right away. Also, there's sometimes fear of movement. Now, I would argue that with ankylosing spondylitis, generally people feel better moving around as opposed to resting, but certain people may be unsure in terms of whether or not they should be engaging in, say, high impact versus low impact exercise, and they might not understand the difference between hurt versus harm. So there are a number of ways of overcoming obstacles, and one is to clearly identify an exercise program and use meaningful activity in order to engage in exercise. So for example, we know from the literature that swimming is a good form of exercise for people with AS. But if you are not inclined to swim, or that's something that you're not really think that you're going to enjoy, then it's probably not the best activity for you to pick. We also know that there needs to be a balance between rest and activity. And we also need to assess our readiness for change. So I'm going to focus a little bit about this, and I'm going to talk about the trans theoretical model. And I have a psychologist watching me, so I'm a little nervous about this. So the readiness for change model was developed to understand people's decision-making in incorporating behavior change into their day-to-day activity. And it was originally looked at in people who quit smoking. So psychologists wanted to understand what was it about people who could quit smoking independent of any exterior motivation. It was all internal. What were the things that led them to that particular change? And we can think about this readiness for change in trying to incorporate an exercise program, for example, into your day-to-day routine. So what they did is they looked at the different stages that people go through when they're thinking about or encountering change in terms of behavior change. And so the first stage is pre-contemplative stage. So I'm not going to exercise, I won't exercise. And then that over time starts to develop into, I might exercise, I'm thinking about it, to the preparation stage of I will. And I would argue that the majority of you, because you are here, you're either in the contemplative stage or preparation stage of change when it comes to how you're managing your spondylitis. The action stage is I am, so you are engaged in regular exercise. And the maintenance stage is that you continue to do so. I still am exercising. The problem is that life comes along. Sometimes there may be flares. Sometimes it's just something that has nothing to do with your disease. It's just something at work or something going on with the family, and relapse can occur. So you quit, you say, I'm overwhelmed, I've got other things I have to deal with that are more of a priority, And so sometimes we slip back in terms of our stages of change. The good thing is, though, is that you can re-enter these stages of change at any point, and you go through the same process. Another way of overcoming obstacles in terms of engaging in exercise is by applying SMART goals. So once you've identified an activity that is meaningful for you, it's important to apply realistic goal setting. So what this means is developing a goal that is specific, measurable, achievable, relevant, and timed. So I'm going to use an example here of, say you've decided that you want to increase your engagement in physical activity, and the way that you're going to do that is you're going to walk home from work, say 3 days a week, and you live about 6 subway stops from your home. You take the subway every day. So your goal is, specifically, you're going to be walking from home 3 days a week, and you think that you can achieve that goal within the next 2 weeks. It's measurable because you know it's 6 blocks or 6 subway stops, and you know that you're going to be doing this 3 days a week. It's achievable because you figure it'll take about 30 minutes to do this. And it's relevant because you need to increase your activity for your arthritis, but you also need to get home from work. And it's timed because you figure it'll take about 2 weeks. So by setting a very specific goal, it sort of breaks it down, and it's that, how do you eat an elephant? Well, one piece at a time. Has anyone heard that expression? The other thing that is important is ensuring that when you engage in a new activity, that you do it in a very graded manner. So you want to gradually build the intensity, duration, and frequency so that you don't relapse. So if you go at it too hard in the beginning, you don't want to fail. We want to build you up for success. So if we use the subway analogy again, rather than on the first go you walk the full 6 blocks right off the bat, maybe the first day you get off 1 stop, the second day you walk 2 stops, and so on and so on. And I want to just mention a little bit about fitness devices. Is anybody wearing one now? Can you put your hands up? So there's a few, not bad. So these can be really good tools in terms of monitoring your activity, measuring your activity, goal setting. It can set reminders in terms of when you should be engaging in activity. You can connect with friends and family through social media. So I think that fitness devices do have a role, and they can be effective tools. So I'm going to just switch slightly here, and we're going to talk a little bit more pragmatically about exercise prescription. And this is not in any way an exhaustive list of exercise. It's supposed to provide a flavor, and it's supposed to provide you with the principles of exercise. And the main principles are that we want to focus on posture. We want to incorporate some form of stretching or flexibility. We want to ensure that we are strengthening our bodies, particularly our core. And we want to ensure that we are working in terms of cardiovascular fitness. And that's important because one of the studies that was published not too long ago, led by Dr. Haroon, showed us that people with ankylosing spondylitis are at higher risk of developing cardiovascular disease, so heart attack and stroke. And I'm also just going to touch on other forms of exercise. So first off, posture. So posture is the foundation of function, and it's the foundation of proper exercise. So this guy here is in proper posture. We call this axial extension. So what that means is when you stand up, you want to make sure that your ear is over your shoulder's over your hip's over your knee, and your knee is over your ankle. So that's considered good posture. The problem is that most of us in this room are on our phones, we're sitting, we're driving, we're watching TV, all these things where we're flexed. We sit for work on our computers. So this starts to feel normal, this head-forward kyphotic posture. And the muscles start to habituate into this head-forward posture so that when we ask our body to sit up tall, ears over shoulders, it feels like you're way back here, right? So one way that you can correct this on your own is just simply find a wall or a door, stand up with your heels back and your head back, kind of relax your shoulders, and then just walk away. So we don't want to be a robot. We're not talking about perfection. we're talking about optimizing your posture. So you want to do the best that you can with what you've got. So here's an example of not so good posture. Does everybody know who this is? It is Shaggy. Does anybody not know who this is? No? Okay, that's good. Okay, so Shaggy has pretty significant head forward posture. He's got rounded shoulders, and we're going to keep coming back to Shaggy. Okay, so as I mentioned, stretching is going to be important. And as I said earlier, I think that it needs to be done on a daily basis. When you engage in stretching, it's important to respect the pain. So I use sort of a numeric rating scale to kind of give the idea of how far you should take a stretch. So if 0 is no pain and 10 is the worst pain, you should take your stretch to about a 4. You want a little bit of discomfort, but it shouldn't be agony. It needs to be slow and prolonged, so you need to hold it for a good 20 seconds. And you don't want to bounce, because if you bounce, it may cause injury. It needs to be a sustained stretch. And don't forget to breathe. The breathing helps to improve the quality of stretch. Often people tend to hold their breath while they're stretching, but if you exhale with the stretch, you'll get a higher quality stretch. So here we've got Shaggy again. And so with Shaggy, we need to work on the front of his chest. So he's got tight pecs. Want to open up the chest, open up the abdominals. He's probably got tight hip flexors. We need to work on the back of his neck, hamstrings, and his calves. So again, I'm just going to show you examples of exercises, but by no means are these exhaustive. So this is a cat and camel stretch, and the reason I like this, the reason I like this is because it works the entire length of the spine from the neck all the way down to the low back. It works the shoulders as well as the hips. Another effective stretch is the hamstring stretch. So your hamstrings are located in the back of your thigh. There's different ways that you can do a hamstring stretch. Sometimes you see runners in the park, they put their foot up on the picnic table and they dive down to stretch their hamstrings, and that's one way of doing it, but it's not a very back-friendly way of doing it. By lying down, the back is supported, and if you use what I call arm extenders, such as a towel or a stiff belt or something like that, nothing stretchy, then you can actually improve the stretch so that it's really focused to the hamstrings. The reason I think the hamstring stretch is sort of one of the big bang for your buck stretches is because the hamstrings go from behind your knee and they insert into your pelvis. And if they're tight, they're going to rotate your pelvis backwards, and then you're going to compensate, again, by that shaggy head-forward kyphotic posture that we're trying to avoid in the first place. So by ensuring that your quadriceps are nice and loose, it keeps your pelvis in a neutral position and allows you to stand in better posture. Okay, strengthening. So in order to gain effects from exercise in terms of strengthening, it needs to be done about 3 times a week, and it's important, again, to ensure correct posture when you're doing the exercise. It's also important to ensure correct muscle activation. So, and this is where I think getting the advice from somebody who is knowledgeable about exercise prescription is helpful, at least maybe one-off or maybe with a follow-up, to make sure that you're doing the right technique for the particular exercise, whether it's stretching or strengthening. And I'm going to use lower abdominals as an example. Most of us have very weak lower abdominals and pretty strong upper abdominals. One way of strengthening these muscles is to lie down and do double leg lifts. But the problem with that is that you've also got very strong hip flexors. And chances are, if you're not doing that exercise correctly, your hip flexors are going to take over and you're not going to be strengthening your lower abdominals. So meaning that technique is very important when you start out with an exercise program. It's also important to progress from remedial to advanced. So it's important to make sure that you continue to challenge the muscles, because they will become stronger, but you need to make them even stronger. It's not enough to just, be doing your one particular exercise and quit there. You need to keep ramping it up to the next level. And obviously we want to make sure that the strengthening exercises that we're doing can be incorporated into daily function. So here we have Shaggy again, and we assume he's got weak abdominals. He's got weak back muscles, buttocks, and And so what we want to do is we want to make sure that we train the core. We want to strengthen the core, meaning the abdominals and the back muscles working together synergistically, because that's the most functional way to train your back muscles. So in terms of a remedial example is the pelvic tilt. So this works the lower abdominals as well as the buttocks. A more advanced form of this exercise would be with a bridge. And so this further engages the core, and it really engages your glutes, your buttock muscles. And the buttocks are important because in some cases, people with AS will start to develop hip problems. And the stronger your glutes are, or your buttock muscles, the less force goes through that joint. Here's an example of a remedial core exercise, which is bird dog. And this is more advanced, a plank. And I also want to just talk about the exercise ball. Does anybody have exercise balls at home? A few, a handful, not bad. How many use them? Okay, so I love the exercise ball because it's a simple tool that you can use to really engage the core. There's about 50,000 different exercises that you can use with the ball, and there's a lot of really good YouTube videos in terms of exercises you can use with the ball. Simply sitting on the ball is a form of core strengthening. The idea is that the ball is an unstable surface, so it requires your muscles to engage to prevent you from falling over. And there's different ways that you can challenge your balance while on the ball. When you sit on the ball, you want to make sure that your hips and knees are at a 90-degree angle, and that the average size for most people is about a 65-centimeter ball. You can get balls now at Canadian Tire, at Winners, wherever. About 10 years ago, you had to go to specialty therapy stores to do that, but that's not the case anymore, so there's no excuse. Okay, now I want to talk a little bit about physical activity. So physical activity refers to any movement that you engage in the day. So this includes recreation and leisure activities, transportation, as we talked about earlier, so how you get to and from work. Are you stuck in traffic for an hour and a half each way, or are you walking or cycling to work? It has to do with how you move around in your occupation. Do you have a sedentary job, or do you have a very active job? And this also includes household chores, games, as well as planned exercise. Oops, yeah. Now, again, in order to gain the physiological benefits of physical activity, which are numerous, we know that when you engage in regular physical activity, that it reduces your risk of developing chronic disease, it improves your longevity and independence, it improves your mental health. But in order to do that, you have to be working within a certain parameter. So 150 minutes of moderate intensity aerobic physical activity per week, or 30 minutes 5 days a week. Sounds a little bit more realistic. You also want to make sure, again, that you're engaging in a regular muscle strengthening program at least twice a week. And this notion of the importance of physical activity in people with inflammatory arthritis was recently endorsed by the EULAR group just this June. And they state that the general PA recommendations, or physical activity recommendations, include those 4 domains that we talked about earlier. So cardiorespiratory fitness, muscle strengthening, flexibility, and neuromotor performance for people with spondyloarthritis. So you may say, well, what is moderate aerobic intensity? So here's some examples of moderate and vigorous. So you got brisk walking, ballroom dancing, general gardening. It's all kind of obscure in some ways. I say use the talk test, something very simple. So if you're engaged in regular physical activity and you're sweating, but you're able to maintain a conversation, you're likely working within a moderate aerobic intensity. I just want to touch on swimming. So there's lots of evidence to support swimming and ankylosing spondylitis. They've done randomized control trials that have showed reduction in disease activity, improved spinal mobility, as well as cardiovascular fitness. One of the concerns with some people, particularly if you have neck involvement, is I'd love to go swimming, but I can't do the front crawl because it hurts my neck or I can't turn my neck. So this was solved by you guys. One of our patients told us that they go to the pool and they use a snorkel. And I've learned recently that they actually have training snorkels now, which are these full face masks with a snorkel that goes up the top. And more people who just train or swimming as a form of training for them will be wearing these sort of training snorkels. So again, it's getting easier and easier to access this more specialized equipment such as balls and training snorkels than it may have been even just 5 years ago. Other forms of exercise such as yoga, Pilates, and Tai Chi are also very beneficial for ankylosing spondylitis. And they're good forms of exercise because they combine posture, flexibility, core strengthening, and some of them even combine incorporate a cardiovascular component, such as yoga. When you're doing the repeated asanas, like sun salutation over and over again, you do get a cardiovascular component to it. So as I mentioned, in some cases you may want to consult with somebody who has knowledge in terms of exercise prescription. That may be a physiotherapist. Physiotherapy in the province of Ontario is covered partially by OHIP, and I'll get into those parameters in a minute, but they're mostly out of pocket or through extended healthcare benefits. Publicly funded physiotherapy is offered to people over the age of 65 or 19 years or younger, or for those people who've had an overnight stay at a hospital. Also, if you're a recipient of Ontario Works or ODSP, then you would be eligible for publicly funded physiotherapy. If you go online, you can find those clinics that are publicly funded by typing in your postal code. And then I also want to mention the Arthritis Society's Rehabilitation and Education Program. And I see Ed sitting there, and I don't have the new logo up. Oops, I know, sorry. So the Arthritis Rehabilitation and Education Program, that is also funded through the Ministry of Health, and you would get your healthcare provider to refer to you, and then a therapist would come either to your home or meet you at a clinic close by and then provide you with an assessment and appropriate management strategies. Also, there's community-based programs available through your local municipalities. And then as we know, there's lots of online resources, including the CSA. And one that we sort of grew here at the Toronto Western Hospital is an e-learning module, and this is available through the public domain. So this has information on ankylosing spondylitis in terms of diagnosis and treatment, and it also talks about self-management strategies, and it has video instruction in terms of, a basic exercise program that you could do at home. And I'm going to leave it there, but here comes part B. Okay. So, where's my phone? Here it is. So part B is we're going to get up and we're going to move. How's that sound? Don't get too excited. Okay, now, and I have to say this one thing. Where's Wendy? Oh, she's not here. So for those of you who are watching this online, your screen is going to switch to a video that isn't us, but is already programmed. So your screen will go blank, and then it's going to switch off to something else, because this is online. So this is for all the online people out there. And then we will be back in 15 minutes, I guess, for the people online. Yeah. And for the people here, we're going to have some fun. Okay, so let me just see here. Got to put my glasses on. Okay. Oh yeah. So this is Casey and the Sunshine Band. Who knows them? Come on, there's got to be more people than that. This is the Shotgun Shuffle. Okay. So in your chairs, sit up. We're going to do chair dance, exactly. So you're going to bring your ear to your shoulder, and then up. Other side. Good. One more time. Good. Other way. Good. Now, we're going to go up and down. Up and down. And then we're going to pretend we're backing the car out of the driveway. We're going to turn and look over our shoulder. Don't run over the neighbor's cat. And then we're going to come back forward. And then again the other way. Hold, 2, 3, and back. Good. And then this again. Don't hit your neighbor. It's kind of tight in here, eh? Okay, and if you can, you're gonna stand up, sit down, stand up. This is functional training of your quads. Sit down. And again, up. And then we're gonna march. Good. And then we're gonna punch. But don't punch the person in front of you. Good. Okay, and then we're going to, if you can, side step, clap, side step, clap. This is like disco. That's it. All right. Shotgun shuffle. Okay, and then back, knees up. Good. Good. Right, and then arm circles again. This is so good. Excellent. Okay, and then big breath in through your nose, and then out through your mouth, and then let's add the arms. Big breath in, out, and then one more time. All right, and Maria's got the doors open, and it's ready for a snack and break.